So what I'm going to do now is talk to you a little bit about the nursing program itself. So to start with sort of the course structure, and I'm going to go through each of these slides and just give you hopefully an understanding of how we deliver the course, how it's structured, and how to, for those of you who haven't applied, how to apply and how to prepare for your interview. So the first thing to note is that the course does have two intakes. We have both a September and March entry for international students. So if you are a student that's applying from what's currently a red list country, so you're concerned about whether you're going to be able to travel to the UK, don't panic. We're currently working at the moment on whether, if you're not able to join us in September, we'd be able to look at moving your offer to March if you do hold an offer. And the beauty of this means that it's only a 6-month wait as opposed to having to wait a whole academic year to come to the following September. In terms of the size of the program, so we have around 180 adult nursing students per year, so it's quite a big cohort. And the structure of the course tends to be slightly longer, so the course will start earlier in the term. You tend to have less sort of breaks throughout the year, and it tends to finish slightly later. And the reason for that is because there's a lot of things that you've got to learn as a nursing student in Swansea. So the program itself is broken down into clinical practice and theoretical areas. So you obviously need to learn the theory to be able to go out and do the practice. So within your first year of the course, you do about 60% of the time in the college and then 40% on placement. The second year, you do about 50-50, so about half and half. And in the third year, you're doing 60% on placement and 40% in theory. So you increase your placement hours every year as you go through the program. And the purpose of this is for you to develop your academic knowledge, but also as you build on that academic knowledge, it allows you to go out and do more and more placements and engage with people, because you very much do placements in the real world with real people. So you spend, as I mentioned, about half your time on theoretical and practical skills. So what that means is, you could see in that video, we have those interactive mannequins, interactive dolls that you can train with. So those interactive dolls or mannequins, if you like, are there to enhance your learning experience. So they are there to help build you up to then be able to go and treat real patients. And you don't just use them at the beginning, but you'll have assessments and different areas throughout the entire course, learning those skills within these environments. And the image you can see here is one of our clinical practice suites. So as you can see, it looks exactly like a hospital ward, but that's actually in the college. So we have these buildings set up to look like hospital wards where you can, build on your experience. We have an emphasis on small group learning and interactive resources, as well as the simulation that I've mentioned. And because, as I mentioned, 180 students is very big, so you will have those areas where you do have big lectures, where they will tell you a lot of information. But for you to really learn these clinical skills, so when you've got to learn things like, say, hand washing techniques or manual handling skills, these are things which you will learn in a controlled environment within the university. And you'll have an academic mentor then to support you for your academic study as well. And they are there to give you guidance on if there's anything you need to pick up on, if you need to improve on, to make sure that you have the best possible student experience when you're going through the course. So in terms of clinical practice, you have the opportunity, as I mentioned, to participate in simulation and scenario-based learning. And what scenario-based learning would be, it might be that you have to learn how to resuscitate a patient if they go into cardiac arrest. Or we've even had it where students, some of the more mature students in their third year, might act as, what happens if a drunken family member turns up on the ward? And this is I know, one exercise that they did, where you get someone who turns up and they're quite abusive to staff. How do you care for the patient whilst managing, that sort of chaotic environment? What do you do if you have two people who are very sick and something happens simultaneously? So you'll have these simulation scenarios which are created by our academics and the more mature students there, to give you an experience of what it's like to actually be on a hospital ward when you've got to manage different things happening at the same time. And these simulation environments allow you to make mistakes safely. That's the primary purpose of them. We want you to be able to know how you approach a patient, how do you talk to them, how do you engage with them. So when you go out and do it in the real world, you've already made those mistakes in a simulated environment. So for example, a really simple one, when you go over to treat a patient, you need to introduce yourself, say who you are, and if you wanted to say take their blood pressure, you need to go, hello, my name's Gareth. I would like to take your blood pressure now. Do you mind if I do that? And then you would go and take their blood pressure. And if you do it with one of our interactive mannequins and you go over and you don't interact yourself, they'll just start screaming at you. And what it does is it drills into you then. That's the way that you engage with people from the very beginning. So once we get you out onto the real environments where you're dealing with real people, you've already kind of had that built into you. It's almost muscle memory at that point when you're doing it. And we have an extensive range of clinical practice suites and equipment, so a whole range of things that you'll learn throughout all of these sessions. And then, as part of our academic staff, we have clinical skills educators who are there who focus on really specific areas. So, as I mentioned, it could be like manual handling or hand washing techniques and a variety of other things that go on. And then you work full-time as part of a healthcare team, and you're assigned a nurse mentor for each placement. So in terms of your academic mentor, they're there to support you academically. And then when you go out into these clinical environments, we make sure that you've got a member of the nursing team, the nursing staff there to support you and give you all the advice and guidance you need when you're in the real world. So if you're wondering, between this 50-50 split, how many hours does that work out to? It's around 2,300 hours or more that you would do as part of that clinical practice. So you would obviously do the same in teaching them because it's 50-50 split. So about 300 hours is spent in simulation. A lot of that is at the beginning to really, in your first semester, get you up to the pace you need to be able to start going out into those clinical practice areas. But then you will come back and do assessments as part of your training throughout the 3 years in these simulated environments as well. And then as part of the real placements you do, so actually going out into the world, you'll do things such as accident and emergency rooms, operating theatres, acute wards. So those are obviously hospital-based environments. Then you might do something like community district nursing, which is where you go and treat people in their homes. So if it's maybe people who have disabilities or people who are elderly and they're not able to move about as easily, you would then go to their homes to carry out treatments there. Nursing care homes is another one, which is obviously elderly populations that are all in one location, and it's easier for you to go in and treat a group of people in one home rather than to transport all of those people to a hospital. And then even local prisons as well. You can see intensive therapy units, so that they will be part of the hospital areas as well. So you do these placements across the 3 years of your course. You don't need to arrange the placements. We have a full placement team as part of the university. And you need to achieve certain clinical criteria in order to get your accreditation with the NMC. So it's our job as your educator to ensure that you meet all of those clinical competencies to be able to register with the NMC on completion of your course. So you will be told, these are the placements, you need to go to this hospital, you're working on this ward, or you're going to this community area. You don't need to worry about that. It's not your job. Your fees are paying for us to arrange those clinical practice areas for you and ensure that you meet all of that criteria in order to register with the NMC. And then in terms of how we teach you, so I've already mentioned you have the large subject lectures. Now, in coronavirus times, as we've had for the past year, these would primarily take place on Zoom. So you would do it as a call like this as part of an interactive webinar. And that would have, big groups of students. And they're really subject-based information sessions. Then we do seminars and tutorials. So these are smaller groups. This is where you can start working with the smaller groups that you'd have. And you'd have an academic mentor that tends to manage that small group. And then you would have the group work that you do with the students themselves, which is separate to seminars and one-to-one sessions as well. There's interactive workshops, which is more theoretical based, but they're where you're actually involved. So they give you scenarios which you've got to work out what you would do to be able to help a patient. Practical research classes, private study time. So that really is your independent study where you're expected to continue your learning outside of the classroom environment. And then in terms of assessments, you're assessed in a whole range of areas. So the essays, poster and oral presentations, research reports, clinical case studies, examinations, and you're assessed in terms of your clinical skills. It's part of those simulation environments as well. And when you go on placements, your placement coordinator, who is responsible for you whenever you go on a placement, will also be there to assess you as part of those placement areas to make sure that you're doing everything you need to meet the criteria to register with the NMC on completion. So I've mentioned this several times. So our BSc Adult Nursing program is known as a pre-registration course. So upon completion of this, it allows you to register with the UK Nursing and Midwifery Council, or NMC. So we say it allows you to. We don't guarantee registration. I say that, to my knowledge, only one student has ever been able to register, and that's because they were slightly down on their hours in a clinical skill area, and they just needed to come back and top up their clinical skills to be able to then go and register with the NMC. So our course will give you everything you possibly need to register with them. So what you do is you complete your course, and then you submit your certificate saying that you've completed a degree, along with your logbook of all of your clinical placement hours, to the Nursing and Midwifery Council, and you'd pay a fee. It's up to £150, I believe. And so combined with that and the fee paid, that allows you to then have your registration with the NMC, which is an internationally recognised qualification and allows you to work in the UK. In terms of entry requirements for the program, so I know you're from quite a diverse range of countries here, so I haven't got the specifics, but you can get in touch with us if you do want to find out what those specific requirements are. But you're looking at the equivalent of 3Bs at A level, and health or science related subjects are desirable, but they aren't necessary. You need English language. So for certain countries, we're able to take your high school certificates. But if they aren't recognised by Swansea University, we will then put as part of your offer that you need to reach the IELTS requirement. And that is a 7.0 overall with a 6.5 in writing. We would do an interview. It says a Skype interview. Traditionally now it tends to be more on Zoom or Teams rather than Skype, but it will be certainly a video conference based interview that you would do. You would need to submit references, so an education and a character reference, an occupational health report, and a police or criminal background check. And for both the occupational health and the police check, they need to be within 6 months of the start date of the course. So if you were to apply now for March next year, you would have to wait until 6 months before the start date of that course before you could submit that. So what you tend to find is that you'll always receive a conditional offer. You can't have an unconditional offer upon submission and completion of the interview because there's this additional paperwork that needs to come through to us, and it can be quite a bit of things you need to tick off as you're working through your application before you would move on to the unconditional area of the course. Go to the next slide. So, little bit of advice really on how to apply. So, whilst your grades are important, what we really want to do is find out from your personal statement why you want to study nursing. And this helps to gauge whether we would give you an interview because nursing isn't a completely academic based course. You're not coming to be a scientist. You're coming to work with patients, work with very vulnerable people who need your care, who need your empathy, and need your support. And quite often they're in situations where it's out of their control. Some people have never been into a hospital and they might be dealing with something which is completely foreign to them, and they're scared and they want someone to be there to make them feel that they're supported and that they're being looked after. So with your application, we want to find out why you want to study nursing. Why do you want to help people in that way? What's your experience of sort of healthcare and hospitals? Maybe you've had a sick family member. Maybe you've been into hospital for something. And then what do you hope to achieve? What do you want to do when you come to study nursing? Obviously you must want to become a nurse, but what's your career aspirations? Do you want to work in an accident and emergency ward? Do you want to be someone who helps in acute care situations? Do you like the idea of community nursing? Do you want to help elderly people? We want to find out what you want to do with this course and how we can help you achieve that. And the most important thing is to be honest, accurate, and concise. Tell us what you think. Tell us what you feel. Show us your personality. Don't tell us what you think we want to hear. Tell us genuinely why you want to do the course, why it excites you, and why you want to come to Swansea to do it. Because it's really important that it's not just a generic nursing program. As much as you're going to do all of these hours and all of these different clinical placements, it's a holistic approach to when you come and study with us in Swansea. It's not just about the course. It's not just about the degree. It's about everything that covers that as well. The learning environment that you're going to be in, the place that you're living, the friends that you're going to meet. So tell us how you found Swansea and why you want to travel here to study this course. So I hope that gives you some indications to what you should do when you're submitting your personal statement. So as part of the interview process, then you might be asked to demonstrate a good understanding of what the nursing role is. So I'd really advise you to go onto the website for the Nursing Midwifery Council. I'd advise you read through everything on our website about nursing. Go on our YouTube channel. We've got a lot of videos similar to the one I showed you earlier. There's a lot of blogs by student nurses and fully qualified nurses. Go and read their blogs. Some of them have TikTok channels or YouTube channels or Twitter streams. Really try and find out what people do, and once you've done that, it'll give you a better understanding of how to answer that question: is what is the role of a nurse? You might be asked to define what caring is, or what does dignity mean. As I've mentioned, you want to become comfortable and familiar with the National Health Service. So what does the NHS do? How is it funded? Find out more about the NMC itself. what does that accrediting body actually do, and look at the health board that we in Swansea are affiliated with, so it's Swansea Bay University Health Board. And you might be asked to discuss a contemporary issue in nursing. So I'm not going to give you guidance on what they might be, because hopefully by doing this research yourself, you'll see the types of issues that people are mentioning if you start looking into this, and that would really prepare you. And my final tip would be, if you've never done an interview via video conferencing software before, I'd encourage you to make the most of the opportunity and the time you've got before it to practice. So go onto Zoom, maybe ask a family member or a friend if they can interview you via Zoom. Google to see if you can find the types of interview questions you might have, and actually do it as a formal interview with a friend on Zoom, because it will prepare you. Because when you drop in for the first time and you're faced with academic staff in a country on the other side of the world speaking in English, it might throw you if you've never tried that before. So it will really help to prepare you and get you in the right mindset. So when you can go in there, you know exactly what you're doing. And my top tip for any of these is to have a pen and paper in front of you. So when they ask you a question, you can write that question down. So when you're answering it, you can keep coming back to look at that question and make sure that you are actually answering the question that they've asked you. So in terms of tuition fees, the tuition fee is going to be £16,000 for September 2021 and March 2022 entry, and then it's an approximate 3% increase every year of that fee. In addition to that, you would need to pay a clinical practice fee of £2,500. But to offset that, we guarantee you an automatic clinical practice bursary of £1,500 per year. So in actuality, what you're paying is £1,000 in addition to your tuition fee every year. Now, the clinical practice fee does not have an increase like the tuition fee does. The reason for that is because that is the fee we've agreed with the health board for you to access all of those placement areas, those 2,300 hours. Well, 2,000 hours because 300 is simulation. So that fee is going to pay for those mentors that you're going to have in hospitals, for you going into those environments and you working in those different areas to meet your clinical competencies as part of the course. And then the tuition fee is covering for us to deliver the teaching and for our teams to be able to arrange those placements for you. So I've put together a timeline of what to expect. So if you haven't applied yet, I'd encourage you to do so as soon as possible. The final interview date for our September 2021 entry is 30th of June. So you need to make sure you've submitted everything to be able to get an interview by that point. If you've already had your interview and you have an offer with us, which I can see looking at the poll, most of you are in that position. The deadline for paying your deposit and your submission for police and health checks would be the 30th of July. Now, if you've got any questions or concerns about that, you're welcome to contact me and I can help you with it. The reason we've given you that date is because it takes some time for the money to come through and for those checks to get approved by the various bodies within the university to approve you to be able to study nursing with us. The 27th of August is your final date of CAS issuance. So the CAS, which is Confirmation of Acceptance of Study, is the letter that you need in order to apply for your visa to come and study with us in Swansea. In order to get the CAS, you need to have met all of the conditions in your offer letter to make your offer unconditional, and we need to have received the £2,000 deposit. So the 30th of July is giving you effectively a month to get all of that information through to us, which will allow us then to issue your CAS letter and then give you enough time to go and apply for your visa and travel to study with us on the 13th of September. I can see someone's put something on the chat. I won't read it now. I'm just going to go through the presentation, and then at the end of it, I'll answer any questions you have about this. So this is just to give you a guideline of what you need to do. Don't panic, because we're here to support you. And I know it might seem like a lot of information, but you have got various members across the university, myself included, who are here to make sure that you get all of this documentation in time and to ensure that you would be able to join us in September. So moving to the next slide. This is just a video. So I'm going to stop sharing quickly just so I can optimize for video. Just of some of our international students from India who can study the program, talking with some other students around the university. So just share that back.
I find it really positive that 100% of the nursing students who are graduating from Swansea University are getting jobs in their respective fields. So that's a really encouraging part of the course.
The clinical practice suites at the university have made a big impact on my experience. They provide a realistic simulation of a hospital ward.
You have sims, which are lifelike people, and then you practice your observations on them.
I'm proud to be studying at a top 100 university for nursing.
Teaching on the course is very supportive. They're very helpful with feedback and with our essays.
You get a good working relationship with them because we're such a small team. You get to know each individual one and they're really there to support you.
Being a nursing student means you're part of a close-knit community. I've met loads of friends on this nursing course, and the lecturers are like friends as well.
From peers to lecturers, it's an inspiring community to be a part of.
Well, on our course, there's 20 of us, and it's a wide range of age group, isn't it? But it's very nice. Because we're so small, everyone gets along very well. We all want the same things, and we hang out outside of university as well, which is...
Tend to go for lunches and stuff.
Since I came from India to Swansea University, I've been able to make quite a lot of friends, students from my course as well as from the Indian community.
Yeah, we got a nice little bunch of students in our cohort. They're really helpful and they won't consider me and Alicia as like international students. They're part of our family. Never thought I would make this much friends here.
So we're just going to go through a final few slides now, just to talk about some of the scholarships and some student experience stuff as well. So if we move to the next slide. So scholarships. So I've already mentioned the clinical practice bursary. So you don't need to do anything for that. If you join us onto the program, so if you're ready to join us in September or March, that bursary will be automatically deducted from your fees. So there's no formal application that's needed. It is an automatic bursary that you receive as part of the program. You're also eligible to apply for an International Excellence Scholarship. This is a scholarship of up to £6,000. So I would encourage you to apply for that as soon as you have an offer. What you would need to do is go onto our website, go to the scholarships page, and you fill out an application form there. It is an excellent scholarship, so they do want to see very good grades when you're applying for it. And if you're successful in that application, you would receive a £4,000 tuition fee discount off year one of your fees. So that's £16,000 would be £12,000 for your first year. And then if you have a 65% grade average or higher at the end of year one of the course, you would receive a £2,000 tuition fee discount off year two. So then you'd only pay full fees for the final year of the course. And if you've got any questions about that, I'm happy to answer them at the end. We also have a British Council accredited English language school in the university. So this is a really great opportunity for you if you have an English requirement as part of the conditions of your offer. So if you haven't met them because either your high school board isn't accredited, or maybe you've attempted an IELTS test before and you haven't quite received the 7.0 overall with a 6.5 in writing, what you can do is you can sign up for one of our SWELT tests, which is the Swansea English Language Test. And that SWELT test is the equivalent of an IELTS score, but specifically for Swansea. It's online and completely free of charge. So if you book onto it, you can take the test with us. And then as long as you meet the requirements, your offer would go from conditional to unconditional. So you can find more. You can see the website here, swansea.ac.uk/ELTS. So I'd say that if you need to do that, it's a really good opportunity for you to get your English test if you haven't met the requirements. So blended learning, I've touched on this a little bit, saying about the lectures being online. So a lot of the learning is going to be online. What we're hoping in September is there might be more classroom teaching, but as you're doing a nursing program, it is slightly different to many of the other courses in universities across the UK, because you do need to go into these simulated environments, and you're going to be doing clinical practice within hospitals. So you are going to be going into healthcare settings. There's no way you can study a nursing course without having some physical presence, because you need to go into these clinical practice areas. You need to learn how to use the equipment, which you wouldn't have at home. And you are, as I say, you're going to be going and doing real world placement in hospitals and nursing homes and all of these different areas. So the blended learning for you is going to be slightly different to someone who maybe does a theoretical course like, say, psychology, because there are practical elements to it. So what we've done for the past year is we've tried to limit them, where you would do a lot of the work online, and then you'd have clinical skills days where you would come into classrooms with a small group of students within. So you heard in that video them saying there was 20 in their group. You would come in, they would split those group into either 5 or 10 people, do it over several days, but you would do a lot of clinical skills within that period, and you do a full day of clinical skills work there. And the purpose of that then is to gear you up to be able to go out and do those hospital documents that are needed as part of your course. Don't worry about it, because we're very good at this. We are a very highly ranked nursing school, and we are very good at looking after our students. And no matter what, the university's policy is that our staff and student safety is the most important thing. So I hope that answers your questions about blended learning, but I'm happy to answer more about it at the end. In terms of student support, so I've mentioned the academic mentor. So this is an academic member of staff who is there to support you throughout the duration of your studies. So they are there to give you all the academic support you need to study with us in Swansea. In addition to that, you have disability support, equality and diversity champions. You can see a list of people that are there to support you throughout the course and leading up to the university and joining the university. From everything from the International Campus Life team who deal with visas, student advice, counselling, the Swansea Employability Academy who are there to help you find work if needed. Although, truthfully, doing a nursing course, if you wanted to do work, you're probably going to do work within hospital environments, and you'll make those connections and contacts by studying on the nursing programme. And then you'll have the Centre for Academic Success. So these are an excellent resource who are there to support you with everything outside of the academic content of the course. So it covers things such as essay writing, advanced academic writing, critical thinking, presentation skills, all these different areas which help you to maximize the quality of your course and make sure that you get everything you need to get the best grades for when you complete. In terms of accommodation, so accommodation is available on both our campus environments as well as a student village, which is off campus, and T-Beck House as well. I would advise that if you're coming to study nursing, you try and get accommodation on Singleton campus if possible. You can't always guarantee that, but that would be what I would say you put down as your first choice. So when you apply, you're asked to pick your top 3 building blocks, halls of residence that you'd like to live in. And the factor is usually for students cost and location are the 2 driving factors. So in terms of cost, you'd pay from roughly £91 to £195 per week. The cost will vary depending on the amount of people you share a room with, and then sorry, not a room with, a flat with, and then how many rooms are within that block. So the lower cost would mean you have more people sharing, the higher cost the less. So for example, the lowest cost, so about £91, is 14 students per flat. You would have 14 bedrooms, so you all have your own individual bedroom regardless of what you pay, but you'd have shared bathroom facilities, so 1 toilet and bathroom per 2 rooms or 2 students. And then you'd have a kitchen area, which is your communal area with 14 people, which would have that space. As you start to pay more, the more money you pay, the less people share. So when you get to the top end of the scale, you would have a block of 8 rooms. You would have ensuite toilet and bathroom, so no shared toilet facilities. And then that communal kitchen area would just be between 8 students. We also will try and accommodate you if you've got specific requests as well around things such as if you wanted female-only dorms or alcohol-free dorms, we can look at that as well. So you can just get in touch with our accommodation team and they'll be able to help you. We're coming close to the end now. So student life. So we have over 100 student societies covering language, culture, subjects, everything from movies and TV shows to rock climbing and surfing. We even have our own Quidditch team. So if you want to hop on a broomstick and run around the campus, you can do that as well. I've already mentioned the campus location, but this is directly in front of the campus. So this is on the beach, as you can see, and it really is a lovely area if you want to, if you want to get to the sea, if you want to go into the city, if you want to get out to the countryside, it's all very easily achievable from our campus. And we also have Discovery, which is a student volunteering service. So if you wanted to do some volunteer work to just have some different experiences, you're able to access them when studying with us in Swansea as well. I won't play this video now, but we can send it to you later. That's it from me. So what I'm going to do now is just say thank you to everyone for attending. If you're watching this as a recording, you can email study@swansea.ac.uk to get in touch. And